Research has shown that our well-being is closely connected to our self-image and sense of self-worth. Dr. Reza qualified as a GP and then became fascinated by the idea that he could get patients to feel better by helping them to look better. It's not the most conventional approach, but then Dr. Mea isn't that concerned about conventional thinking, as Zaki discovered.
Dr. Reza has the looks and lifestyle that wouldn't be out of place on TV. But his family and friends will tell you that he's very real. He's also very active in the field of aesthetic medicine and contributes his time to helping young patients with facial problems.
I don't usually bring a camera crew with me when I visit the doctor, but today we're going to meet someone who isn't your average GP. We're taking a closer look at Dr. Reza instead of the other way around. Dr. Mea.
Hello, how are you?
Thank you for inviting me into your chair.
Good, nice to see you again. Have a seat.
Thank you. So what procedures will you be performing on me today?
Today we'll be doing the Mega Boost Vitamin Infusion, which gives you a nice dose of vitamins, minerals, antioxidants, and it'll give you a bit of an energy boost. So before we begin, we'll do your vitals and do a nice just a general medical check. Make sure you're in fit and healthy condition.
Awesome.
Having checked her blood pressure as well as heart and lung functions, Dr. Mea was satisfied that Zaki was, in fact, as healthy as she looked.
So why am I doing that?
Okay, keep very still for me, okay?
He then proceeded with the first stage of the treatment, which his patient chose not to watch too closely.
Thank you so much, Carmen. Pleasure.
Thanks, Carmen.
Reza, what are the benefits of IV treatments and boosters over normal oral supplements?
The main difference is anything that you take orally is absorbed through your gut and that passes through your liver, and we have something called the first pass metabolism. So you will remove or destroy much of what you ingest. Versus when you put it into your veins, it goes straight into your bloodstream and you can better access whatever it is that you're trying to take.
And are they safe, she says, while having one in her arm?
Yes, they are. You know, there's certain conditions where you shouldn't be using this. For example, if a patient has an allergy to any of the ingredients, or if they have any sort of condition that, makes it unsafe to be putting fluid into them.
What is the influence of positive self-image on our health?
It's interesting that they've done studies that show that looking good actually makes you feel better and lifts your mood. So it's important to look after both of those elements. You know, aesthetics is a very exciting and dynamic field. It's always growing, there's always new things coming out. Skin boosters is a new type of filler that we use. Very tiny molecule designed to create little collagen sponges under the skin. These absorb water and very effectively treat fine lines, acne scars, moisturize the skin. You think of it like internal moisturizer.
I've heard about a non-surgical facelift. Can you elaborate on that for me?
Sure. You know, previously we used to rely on injectable toxin, for example, in the jowls and turkey neck to give us that lifting effect, as well as filler in the cheeks and nasolabial folds to give a little bit of a lifting effect. The problem is if you try to use any of those methods in excess of what looks normal, you run the risk of having a patient look like they've had something crazy done to their face, which is never the end point. With the resorbable sutures with absorbable cones, what we do is we run it under the skin and we target specific areas to lift the nasolabial folds, the jowls, the neck. We've even done brow lifts. And this allows us to achieve quite a remarkable result without surgery. You know, we do it under aseptic conditions, but we do it here in the chair.
And how long does that last?
You'll get about 2 years out of each treatment. You feel a bit more energized?
I feel like I could run a marathon.
Good.
I know you're involved in a lot of diverse projects. I'd love to hear more about those.
Sure. Well, maybe it's better if I show you one.
That would be great.